Hi, my name is Abby Swanson, and I am giving a presentation on Spina Bifida today for our Lifespan Development and Disability class at Emporia University. Spina bifida is one of the most common permanently disabling birth defects. It affects approximately 1,500 to 2,000 babies per year, which means it's about every day, 4 to 5 babies are born with this condition in our country alone. The global prevalence varies, but is estimated around 0.5 per 1,000 live births, with higher rates in certain regions. Some areas with lower access to prenatal care and folic acid supplementation has higher incidences. Understanding these statistics kind of helps us understand the widespread impact of spina bifida and the importance of early interventions and support. There are different types of spina bifida. One of the first type of spina bifida is spina bifida occulta. This is the mildest form. And it often is asymptomatic. Many people with spina bifida occulta may not even know that they have it unless it's discovered, looking for a different reason. It involves a small gap in the spine, but no opening or sac on the back. Another kind of spina bifida is meningocele. It's a rare form where the spinal cord develops normally, but meninges, which are the protective coverings of the spinal cord, push through it in an opening in the vertebrae. This can create a sac filled with fluid. While it can be surgically removed, it may still lead to some neurological issues. The third form of spina bifida is myelomeningocele, which is the most severe form, where the spinal cord and the meninges protrude through an opening in the spine, forming a sac on the baby's back. This condition often leads to significant disabilities, including paralysis and loss of sensation below the affected area. It also increases the risk of infections and other complications. Typical onset of spina bifida occurs within the first 28 days of pregnancy, when the neural tube, which eventually forms the brain and the spinal cord, fails to close properly. This early onset means that the condition develops before many women realize that they are even pregnant. The exact cause is unknown, but there are several risk factors, such as folic acid deficiency, which is when early pregnancy there is not enough folic acid intake for neural tube development. Women of childbearing age are often advised to take folic acid supplements just to reduce this risk. Also, there's genetic predisposition, family history of neural tube defects, which can increase the likelihood of spina bifida. Maternal diabetes or obesity. These conditions can affect fetal development and increase the risk of birth defects. Also, exposure to certain medications during pregnancy. Some medications, such as anti-seizure drugs, can interfere with the neural tube development. So it's important for women to consult their healthcare providers about the safety of their medications during pregnancy. Next is our functional limitations, adjustment demands, and typical course of the disability. Spina bifida presents various functional limitations, such as they may experience varying degrees of paralysis and mobility limitations, often requiring assistive devices such as wheelchairs, braces, or crutches. Physical therapy can help improve mobility and strength. There's also bladder and bowel dysfunction. Many individuals face challenges with incontinence and frequent infections. They may need to use catheters or other medical interventions to manage these issues. There's also orthopedic concerns, such as conditions such as scoliosis, hip dislocation, and joint contractures are common. Regular orthopedic evaluations and interventions are necessary to address these concerns. For adjustment demands, medical management is a big thing. Regular medical appointments, surgeries, and therapies are part of life for individuals with spina bifida. Coordinating care among various specialists can be really challenging, but it's very essential for optimal health for these individuals. There's also psychological or psychosocial adjustment. Coping with physical limitation, social stigma, and emotional stress can be difficult. Support from family, friends, and mental health professionals are very important. Family dynamics play a role also. Increased parental stress and need for family support and resilience cannot be overstated. Families often need to adapt their routines and find ways to support their children's needs while maintaining their own well-being. Typical course of the disability. So in early childhood, the focus is on surgical interventions to correct physical abnormalities and early mobility support to encourage independence. In school age, there's educational accommodations and social integration. Children may need IEPs and support from school counselors to succeed academically and socially. Into adulthood, transitioning to independent living and vocational training and long-term health may face unique challenges in the workplace as well, and they need ongoing support to navigate these transitions. As counselors, we play a very important role in supporting students or in individuals with spina bifida and their families. During the initial intake session, building trust is very important, so establishing a safe and supportive environment is the first step. It's important to listen actively and show empathy to build a strong therapeutic relationship. The comprehensive assessment, understanding the individual's medical history, challenges, and strengths helps tailor the counseling approach to their specific needs. Family dynamics, so exploring the family's coping mechanisms and support systems provide insight into how best to support the individual and their family. So subsequent counseling appointments, individual support involves addressing emotional and psychological needs, promoting self-advocacy, and helping individuals develop coping strategies can enhance their quality of life. With family counseling, this can be providing resources and strategies to support the family members, help them manage the stress, and improve their ability to support their loved ones. Educational advocacy, so assisting with navigating educational accommodations and services, make sure that the individual with spina bifida receives the support they need to succeed academically. Role of counselors is really all about support, so offering emotional and psychological support with individuals and families, help them cope with the challenges of spina bifida. Resources include connecting families with medical, educational, and community resources and providing them with the tools they need to manage the condition effectively. And advocacy, so advocating for the rights and needs of the individual with spina bifida ensures that they have access to necessary resources and accommodations. And some takeaways from these materials, I have gained, several insights. I have developed a deeper understanding of the challenges faced by individuals with spina bifida and their families, fostering greater empathy and compassion. This empathy is crucial to providing effective support and building strong therapeutic relationships. Also, my holistic approach, so recognizing the importance of addressing both medical and psychological aspects in counseling, make sure that we have comprehensive support for clients. This holistic approach helps address the multifaceted needs of individuals with spina bifida. Advocacy skills, so learning the critical role of advocacy in helping clients navigate educational, medical, and social systems to access the necessary resources and accommodations. So counselors are prepared to advocate for clients' rights and needs, as well as family dynamics. So appreciating, the impact of spina bifida on family dynamics. It really highlights the needs for family-centered counseling and support, and understanding the family's perspective helps us provide more effective support and interventions, as well as lifelong support. So understanding the lifelong nature of spina bifida management and emphasizing the need for ongoing support and adaptation throughout different life stages. As individuals with spina bifida transition through various life stages, their needs and challenges will evolve and change, requiring continuous support and intervention. And here are my resources. I hope that this presentation has provided you with valuable insights into spina bifida and the role of counselors in supporting individuals and families affected by this condition. Thank you so much for your attention.